afternoon. Welcome to today's press briefing. I'm Caroline James in for Donna Bush. Thank you very much for joining us on CIG TV, YouTube, Facebook, and our listeners on Radio Cayman. A reminder, if you're watching on YouTube, remember to hit subscribe. You can click on the notifications bell and you can stay up to date with all of our latest content. We're going to start this afternoon's press briefing with a prayer from Pastor Terence Bobb.
I am Terence Bobb from the Cayman Ministers Association. And would you please join me in prayer as we ask God's blessing upon the press briefing today? Let us pray. Our Heavenly Father and our God, we say like the psalmist, God is our refuge and strength, an ever-present help in trouble. And so we call upon you today, asking that you will grant continued wisdom and direction to our governor, our premier, our health minister, our medical personnel, and those in authority over us. Grant, O God, to these men and women the help and the wisdom and the protection that they need. I ask that you would help us, O God, as residents, to be cooperative with them, to work with them. Help us to look out for one another. Help us to follow the guidelines that have been given. And so, Father, we look to you, our help in ages past and our hope for years to come. So give guidance and direction in this press briefing, and let your hand of protection rest upon all of the residents of the Cayman Islands. In Jesus' name, amen.
Amen. Yeah.
Thank you, Pastor. I'd like to welcome His Excellency the Governor, the Honourable Premier, the Honourable Minister for Health today, and we'll begin with an update from the Chief Medical Officer, Dr. John Lee. We're also joined today by our sign language interpreter, Ms. Carolyn Powell.
Good afternoon. Today I have a further 18 results to report, four of which are positive. All of these positive cases relate to traveller incidents. Two had travelled themselves and two others were immediately related with contacts to travellers themselves. All of them have been isolated either since symptoms developed and since they travelled, and their contacts are being in the process of being tested. I also wish to advise the public that of the people that have tested positive, their age range is between 21 and 83 years, 5 of which are males and 7 are females, and 4 of them, and these are in fact the older people involved, have long-term health conditions.
Thank you. Any questions from the media related to Dr. Lee's latest update?
Can you give us the overall total now, so that the public can have a picture of where we are?
Yeah. I need to correct one of the figures because it's come to our attention that one of the negative people had actually been tested twice, so it was actually a double count. So the negative numbers will drop by 1. So yesterday it was 190, that became 189 for the total number of people that we tested. That increases by 18 to 207 now. Of the negatives, that dropped from 181 to 180, and now the negatives are increased by 14 today to 194, and the positives were 8 yesterday, and they go up by 4 to 12 today. The numbers at the BRAC, Cayman BRAC, and a Little Cayman have unchanged, Cayman BRAC having had 3 people tested, all of whom are negative.
We had one more question for Dr. Lee, related to the obligation on persons for reporting COVID-19 symptoms. So patients, are they asked to call the flu line, and does that process differ for private doctors or other healthcare professionals who might see flu-like symptoms in their work?
Anybody can contact the flu line. It doesn't matter who your normal primary care provider is. However, if you wish to contact somebody for advice, you're of course more than able to contact your own primary care doctor to seek their advice. If they feel that you need to contact the flu line for any further follow-up or check, they will advise you to do so.
And is the onus on those doctors to report to public health if they are concerned that this patient might be someone who potentially would need to be tested for COVID-19?
They would need to make sure that their patient had done so and follow up with the patient to make sure the patient had done so if they had concerns. I don't know of a circumstance in which somebody has asked them to do that, and that hasn't happened.
Kevin.
Sorry, we have to actually stand. Thank you. Dr. Lee, can you give us some background into how many of the patients, I guess, were in the community for a period of time since they came back from traveling wherever, and how many were not, possibly taken from the airport directly to isolation?
What I understand of these is that two of the people were actually people who were living in the community and who had direct contact with somebody who had travelled. Two of them were actually travellers who had automatically, because they had been travellers, isolated themselves. But it does really really stress to us the importance at the moment. The travel history is becoming increasingly irrelevant as we're almost out of that time period. But for all Caymanians, please to stay home, because we do not know where you might meet a potential threat from this virus, and that is why we've gone to such extraordinary means to try to get people to stay at home through all mechanisms possible. But please, can people stay at home in order to protect the lives of everyone in the community, and particularly the elderly and the more vulnerable. So even if you're healthy yourself, please protect everybody in the community.
Thank you, Dr. Lee. And just one follow-up as well. The person who two of the patients had contact with who had a travel history, is that person also a patient who we know has tested positive? I guess the link who had been traveling? So two of the four cases that we're talking about right now, two of the four patients had contact with somebody who had been traveling. Is that correct? And is that person somebody we know who has tested positive for COVID-19?
All of these four cases, the travel history does not link to anybody that's, one of them actually links to somebody that we know had been traveling because they were traveling together. So it's in fact somebody who's in the same household. But the others were, and another of those was also again related to that incident, but none of the others were related to anybody none of them have been related to anybody that's been in the hospital, no.
A question for you, Dr. Lee, from Cayman News Service. She asks, are the patients okay? How are they doing? And if you have any update on the inconclusive case.
I haven't an update on the inconclusive case. We're still waiting for further sample to go through the testing process. I don't have any update other than the one Dr. Williams gave you yesterday, that everybody is doing well. There's no change.
The follow-up question is, were the travellers' relatives isolated before they contracted the virus, as far as you can tell?
I don't entirely understand the question. It doesn't quite match my knowledge. So the travellers who had returned had automatically isolated themselves because they had been travelling. The moment somebody developed symptoms and were tested, that all of the close contacts of that person were also isolated.
Perfect, thank you. We have no other questions from the media for Dr. Lee. I'd like to invite Commissioner Byrne to give us an update on the situation with the curfew.
Good afternoon. Just to report overnight for last night. The hard curfew operated quite well last night. We had almost full compliance. There were no significant policing issues across the islands. Looking at Little Cayman, no issues at all overnight. Cayman Brac, 11 interceptions by police, 2 persons in 1 vehicle found to be in breach of curfew order, and they were both warned for prosecution, no requirement to arrest. Grand Cayman last night, or overnight, 66 vehicle interceptions, 1 person found to be in breach. In addition to the curfew breaches, then we had 4 breaches of the criminal law, and unfortunately at 8:26 p.m. last night we had 1 person out driving under the influence, and I might say exceeded the limit by large numbers, as well as being prosecuted for being drunk under the influence and driving while under the influence. He will also be prosecuted for breach of curfew. We dealt with a domestic violence incident and 2 disorderly conducts occurring in the family home. So not breach of curfew, but criminal offences dealt with by the police last night. Today, so far, the soft curfew is going quite well. There is significantly less traffic movement around Grand Cayman. Checkpoints are in place at strategic locations across Grand Cayman. The helicopter is paying particular attention to the beaches and the strata across Grand Cayman, and there are no major reports of any breaches, although there are some concerns around numbers congregating on the beaches. Not very many, I might add, but some concerns, and those are being addressed by our ATVs, which are on patrol of the beaches. Our marine units are out on patrol in the waters. No breaches detected so far this afternoon. That is the current position. As we move into next week, first of all, as we move in tonight at 7 p.m, the hard curfew returns. So remind everyone that's a full lockdown, stay home, Cayman. I turn to some concerns we may have tomorrow, and I do have some concerns about how the traffic will move tomorrow, but I think maybe the Governor and the Premier will be making some announcements, and I can deal with that afterwards. So that's the report from the police of the overnight activities across Cayman Islands. Thank you.
Any questions from the media for the Commissioner?
Afternoon, Reshma Ragana, Cayman Compass. Commissioner, we saw pictures being circulated today of long lines of traffic. You said there were checkpoints. Can you brief us on what those long lines were about? We are in the soft curfew, so I think if you can help shed some light on the numbers that we saw being circulated through the pictures.
Thank you, Reshma. So the regulations in place for the soft curfew impose requirements on persons moving around the islands. You must have a legitimate movement. You must have a legitimate reason to move around the island. It is not free, unobstructed movement. It is purposeful, and it must be provided for under the regulations. And as I said, the officers are in place at strategic locations, and they are asking those questions as provided for under the regulations. And this will be the same. This will continue for the duration of the soft curfew. So it is unfortunate we do have checkpoints in place, and they create some backlogs, but this is the requirement of the soft curfew, and it will continue throughout next week.
A question, Commissioner, from Cayman News Service. Are you satisfied that normal policing operations can continue, in particular that you're able to watch out for the canoes that might be bringing ganja in from outside and other normal policing operations at this time?
Yes, as I said, the crime platform is very, very stable. We are watching the helicopters out working extended hours, and the giant marine are out working extended hours. So we're very cognizant that business continues around the curfew, and all of that is being watched. And as I said, we're operating on a very, very stable crime platform.
Thank you.
Talking sideways. Commissioner, could you just reiterate the penalties for both the hard and soft curfew? I've had some people asking, they're a little bit confused about that.
So the soft curfew, which is provided for under the public health regulations, is completely different to the hard curfew, which is provided for under the police regulations. And the penalty for the soft curfew, which is between 5:01 a.m. and 7 p.m. daily for the 10 days that it was in force or is in force, is a fine of $1,000 or 6 months imprisonment. The hard curfew then is $3,000 of a fine or up to 1 year's imprisonment, or both indeed, depending on the circumstances.
If there's no further questions, I'll turn now to the Honourable Premier.
Thank you. Hello, everyone. Blessed Sunday, blessed Sabbath to everyone. I want to start with my now customary Grim Reaper report. The current number of cases in the United States of America is reported at 135,627, up 12,049 overnight. The total number of deaths, 2,385, up 165 overnight. Italy, 97,689 cases, up 5,217 overnight. Total deaths, 10,779, up 756 overnight. Spain, 78,799 cases, up 5,564 overnight. Deaths, 6,606, up 624 overnight. In the UK, 19,522 cases, up 2,433 overnight. Total deaths, 1,228, up 209 overnight. And in New York, which is the U.S. state with the largest numbers, total cases, 59,513, up 6,120 overnight. Total deaths, 965, up 82 overnight. I want to spend a little time talking about the supermarket situation yesterday and the plans going forward. I think everyone is aware that yesterday proved a great challenge with respect to the operations of the supermarkets, not so much inside, but certainly managing the queues outside the door. And I think we're all in agreement that that sort of arrangement significantly increases the risk of transmission, community transmission of the virus because of the sheer number of people who are in relative close proximity to each other. So over the course of yesterday and this morning, we have worked with the supermarkets to devise a new arrangement with respect to access to the supermarkets. Starting tomorrow morning, Monday the 30th of March, until further notice, adults with the last name beginning in A through K will be allowed to enter supermarkets in order to shop for essential goods on Mondays, Wednesdays, and Fridays. Adults with the last name beginning in L through Z or Z will be allowed to enter supermarkets in order to shop for essential goods on Tuesdays, Thursdays, and Saturdays. It is recommended that only one member of your household attend supermarkets in order to shop for the family. We strongly discourage taking children to the supermarkets. During this time, supermarkets have adopted the following opening hours from Monday to Saturday. All Foster's locations, including Priced Right, opening from 6 a.m. to 6 p.m., with the first hour of operation from 6 a.m. to 7 a.m., solely dedicated to senior citizens, disabled persons, and pregnant women. Essential government staff will have a dedicated line from 5 p.m. to 6 p.m. each day. Hurley's Marketplace, opening from 7 a.m. to 6 p.m., with the first hour of operation from 7 a.m. to 8 a.m., solely dedicated to senior citizens, disabled persons, and pregnant women. Essential government staff will have a dedicated line from 5 p.m. to 6 p.m. each day. Cost You Less, opening 7 a.m. to 6 p.m., with the first hour of operation from 7 a.m. to 8 a.m., solely dedicated to senior citizens, disabled persons, and pregnant women. Essential government staff will have a dedicated line from 5 p.m. to 6 p.m. each day. Kirk Market, opening from 6 a.m. to 6 p.m. All locations have arranged for a front line of service for senior citizens, disabled persons, and pregnant women during normal hours of operation. If I may reiterate that starting tomorrow morning, Monday 30th of March, until further notice, adults with the last name beginning in A through K will be allowed to enter supermarkets in order to shop for essential goods on Mondays, Wednesdays, and Fridays. Adults with the last name beginning in L through Z or Z will be allowed to enter supermarkets in order to shop for essential goods on Tuesdays, Thursdays, and Saturdays. It is recommended that only one member of your household attend supermarkets in order to shop for the family. We strongly discourage taking children to the supermarkets. If I may just comment briefly on the Commissioner's report about the traffic situation. Indeed, today is much, much better than yesterday was. But we're all conscious that today is Sunday and tomorrow is Monday. We really do need to make a special effort, all of us in the community, to restrain ourselves from taking unnecessary trips. The regulations are quite clear that trips out, unless you are exempted from the provisions for specific purposes, trips out ought to be only to go to the supermarket or the other limited number of stores that are allowed to open, to the gas station, to the bank, to healthcare facilities, or for an hour and a half to exercise. If you are on the road for other purposes, you are in breach of the regulations, and if you are stopped by the police, you risk being charged ultimately with a breach of the provisions of the regulations relating to shelter in place or the soft curfew. The police have stepped up their surveillance. You would see many of you who are on the road would have encountered roadblocks or checks. That is going to be the case for the duration of the soft curfew. I urge everyone to do everything you can to stay off the roads, to stay at home as much as you can. You would have heard today that we have an increase in the number of positives by 4. We expect that number is going to continue to climb. So far, all but the one instance that Dr. Lee referred to can be traced to travel in one way or the other. But frankly, we don't know, despite our best efforts to trace, if we have been able to contact every person that those positives have been in touch with. They probably don't know themselves. In the course of a day or night, you encounter many people. If I had to try to keep track of everybody that I've encountered in the course of a normal day, I just wouldn't know where to start. And that is the case for many of us. The only way that we can reduce our risk of contracting the virus is to stay away from as many people as you possibly can. Stay home. Cayman. The police are under a great deal of pressure, operating both the hard curfew and the soft curfew. I want to thank the Commissioner and the incredible officers under his command, as well as those from the CBC and elsewhere, it's the Special Constabulary, who are working so hard in the hot sun these days to make sure that this works. But if the Commissioner winds up telling us that he simply cannot do this because of the sheer number of vehicles on the road, we will have to move to some sort of similar arrangement to that which we are employing with respect to attendance at the supermarkets. We really would prefer not to have to go down that route, but it is something we are planning very carefully in the event that we do not get the kind of national compliance which we need to ensure that the police are able to continue to enforce these curfews over the next while. We do not know how long this is going to have to continue. As I keep saying, this is a constantly evolving situation, and we are being guided by the results of tests, what's happening in the local community as far as we are able to discern. And we will continue to adjust the plans and the way we deal with this depending on the circumstances. Again, I want to thank everyone who is working so hard, doing so much to help us make this work. I particularly want to single out for praise the acting director of the Port Authority, Mr. Joseph Woods, who is really an unsung hero in many respects, but is doing an incredible job of making sure that we continue to get the necessary supplies we need to keep the country fed and provided for in every respect. I also want to close by thanking the thousands and thousands of Caymanians and people who are here, who are really working hard to comply, who are influencing and leaning on people and quarreling with people who don't want to comply, to try to urge everyone to do the right thing so that we can avoid the catastrophe that COVID-19 will be to this community if we get into community spread. Thank you for listening to me.
Your Excellency.
Thank you. Thank you very much, and good afternoon, everybody. One statistic the Premier didn't quote, which I found very sobering this morning, was that across the world, 2.5 billion people are now in lockdown. So a third of humanity is in lockdown, and that is increasing all the time. So it does underline the gravity of this crisis. I'm really pleased that the night curfew seems to be working very well, and very grateful to the community that we're in a much better place today, as the Premier has said. And I know we're asking an awful lot of people, but we really do need the cooperation of everybody. I think the new plan for supermarkets is very sensible. Supermarkets will remain open, so tomorrow we don't need to see a rush of people on the roads first thing in the morning. There's no need for panic buying. We have supplies, we have imports coming in as normal. So we really do need to see a lot less traffic on the roads. I just want to refer briefly to a couple of other things. Firstly, I've mentioned before we have an emergency hotline, helpline for anyone who urgently needs to leave the islands, whether it's for medical reasons or compassionate reasons. And we've been speaking to BA about arranging a flight. I hope to be able to make an announcement quite soon on that now. We've had good discussions, but we do need to know if there are people out there who need to leave to go to London. So please do ring the helpline if you want to let us know. It's 244 3333. I also just want to say a quick word about the Defence Regiment, because we've had a number of questions on that. Of course, we've had to pause it because of COVID-19. As you all know, we had got the commander appointed, 2 senior officers, 5 junior officers who'd gone to Bermuda for training, and a sergeant major. The next step was to recruit the 50 new reservists and send our officers to Sandhurst. We've had to pause that, but we are deploying the regiment on COVID-19 support. So 3 of the officers have been helping hazard management. 3 of them have been working on our hotline, and we've also had 1 of them at the Sunshine Suites helping with the supervision there of our returning students. And I say again that I do think a crisis like this just shows how valuable a defence regiment will be for the Cayman Islands. I've also had a question about the other overseas territories. I just want to very briefly give you some statistics about COVID-19 there. There are 93 cases in total in the other overseas territories. 55 of them are in Gibraltar, which is obviously very close to Spain, 5 in Montserrat, 17 in Bermuda, 2 in the Turks and Caicos, 2 in the British Virgin Islands, and 2 in Anguilla. The Cayman Islands at the moment has the only death, but of course that was imported. Finally, I just want to note that there's a lot going on in terms of international developments to try and find a vaccine for this, but it's still going to take a long time. The UK is in the forefront of those efforts and has announced a contribution of £210 million to the international coalition of trying to find a vaccine. That's the single biggest contribution of any country in the world at the moment. And I do also just want to say that there's a lot happening on testing, and as we move into this crisis, this is our key challenge here, and there's a lot of work going on behind the scenes to work out how we move forward on all of that. Thank you.
Minister.
Hi, thank you. Good afternoon, everyone listening. Happy Sunday, including Cayman Brack and Little Cayman. Again, I want to thank the staff in uniform, all of our medical staff and civil servants and law-abiding citizens of this country. Your efforts are saving lives. I want to turn your attention to some information on the healthcare system in the Cayman Islands. The Health Services Authority has the primary role of ensuring the health and well-being of the nation. Our preparedness and response in this global public health emergency. Today, I want to provide a brief update on the plans and activities being undertaken by the HSA in terms of their planning and preparedness, resources and capability to ensure sustainability of the healthcare delivery system in the event of widespread community transmission in the Cayman Islands. The stringent measures already announced by the Premier and the government, along with the plans being implemented by the National Emergency Operations Center, has made a significant impact in our mitigation and containment efforts and placed the Cayman Islands ahead of other regions in the fight against this pandemic. The HSA is taking actions to not only keep our community safe, but to provide an effective and sustained response to any significant community spread, and is taking all necessary steps in order to be prepared for the worst case scenario. The HSA has developed a COVID-19 action plan, which sets out a comprehensive step-by-step approach to ensure effective coordination of resources, response, and clinical outcomes. Established a multidisciplinary task force of clinicians and physicians, nurses, allied health professionals from a broad range of specialties who meet daily to review and monitor global trends. Relevant clinical data and guidance, develop best practices, policies, and procedures and strategies for patient management and effective clinical decision making. A COVID-19 hospital operations team with representation from across the organization, including clinical, operational, finance, human resources, supply chain management, facilities, which also meets daily, bringing together the clinical and operational perspective to drive a coordinated response plan to ensure our operations are aligned with efficient clinical delivery. This includes representation from the sister islands. Through the work of these teams, we have implemented a range of robust activities which have been very effective at containing community spread. These include the flu hotline, which has been very effective, and we continue to encourage people with flu symptoms to contact the flu hotline at 1-800-534-8600 or 947-3077 or email flu@hsa.ky. Medical professions are answering your calls and will either direct you to stay home or will direct you to a flu clinic. It is important that persons call the hotline before showing up at the flu clinic, as this is important in the event you are suspected of as a COVID case. Since the hotline started on March 15th, the team has handled 1,434 calls, with the lowest record volume of calls yesterday at approximately 50. The flu hotline also handles calls from the sister islands. The dedicated flu clinic, which we believe is among the significant initiatives at containment, started on March 16 and is now open at 8 a.m. to 4 p.m., 7 days per week in Grand Cayman and Monday to Friday in Cayman Brack at the Ashton Ruddy Center. since it commenced, the clinic has seen 228 patients in Grand Cayman and 19 in Cayman Brac. With dedicated flu clinics, we have been able to control the movement and treatment of patients with flu symptoms in the appropriate clinic settings. The focus has been on testing capabilities, so I want to reassure you that the HSA has PCR testing kits on hand. With the 480 received yesterday, we now have 520, and we are expecting more from the UK this week. Doctors Hospital is also working to secure the ability to do local testing, and we'll keep you updated once this is all in place so that we'll add to the island's testing capability when that comes on stream. We also want to reassure the public that the HSA has sufficient quantities of the various types of PPE. However, we are sourcing additional supplies in the event our numbers increase as projected from what is happening globally. For gloves, we have 219,000 on hand, with 938,000 on order. Surgical masks, we have over 106,000 on hand, with 83,000 on order. With N95 masks, we have over 3,500 on hand and over 300,000 on order. Isolation gowns, we have over 2,000 on hand with 71,000 on order. Face shields with and without masks, we have 360 on hand and we have 52,000 on order. Goggles, we have 500 on hand and 5,000 on order. Beyond those initial preparedness activities, as we monitor the global situation and the challenges of other countries in healthcare systems, our priority is on ensuring the availability of our resources and to keep healthcare workers safe as they care for the public. As you've seen and heard, a lot of traffic is on the road and people trying to go out to and fro. And I know we have been going through a lot lately. You had a 7.7 earthquake. You had the dump burning. Now coronavirus. But always remember to call the mental health hotline if you're feeling overwhelmed. That's 1-800-534-6463. I am asking you, the public, to consider whether going to the supermarket versus getting it delivered is worth losing your life. This is your decision. Consider whether going on the road for no reason whatsoever is a selfish act if you contract the coronavirus and infects your whole family and your neighbors and one or two of them dies, if that is worth it staying home. These are things to consider. We are not trying to restrict you from anything that is necessary. What we are trying to do is help you protect yourself so you can be there for your family. This coronavirus or COVID-19 is at times aggressive in nature. We have had concerns from persons about the banks in terms of opening only one of their branches, possibly causing problems with bringing long lines at one of their branches and traffic congestion. I think this has some merit, and the banks ought to think about that, in my personal opinion. I'm saying to employers, please, if you haven't done so already, divide up your essential staff, if you can, and put them in rotation so everyone doesn't get sick at the same time. As if one person tests positive, everyone would be put on isolation. I go on to say that whilst all of this is going on, we have some accidents on the road. We have some Caymanians who are passing away. We had one noted Caymanian from the Bordentown district who was 102 years old, Miss Ariel Christian, who passed away. She was just a couple days short of her 103rd birthday. She was the second oldest person in Bordentown. And she's one of a handful of Caymanians and indeed people in the world who were alive during the world's last major pandemic in 1918 Spanish flu. It is poignant that she's entered this world. We were facing a pandemic and she has departed this life. We are again facing a global pandemic. May her soul rest in peace, and may God be a comfort to her family, which I know well. Also, I want to note that the accidents they had on the road over the past few days, we want to send out our concerns and sympathy for the families. We had one again in Bordentown and West Bay, and everything we are doing now is for your protection and survival. It is so important that we are following the curfew regulations and shelter orders in place. I'm sending prayers for the young men, Bordentown and West Bay, and for their families and the entire community. Let's stay home and save lives. I also want to say that thank Pastor Bob for kicking off the prayer before a press conference today. I think here onwards we'll have another pastor in rotation kicking off, which is what the country was really asking for. Before I end, I want to say, those who honor me, I will honor. We're truly blessed by God, not because we are so good, but because He is good and we honor Him. So they won't lose the battle on Corona unless He lose their focus. Stay focused on God. He has to be a part of this equation in our hope. Let us all, I call for 3 days of prayer and fasting. Everyone is home, so why not 10 a.m. every day? Remember to carry your ID on you. The police will be stopping you and asking you for it. If you have a letter, have it available or take a picture of it. We are trying to save lives here. Thank you and God bless.
Thank you.
Caroline, could I just clarify one thing? The travel hotline that I mentioned is Monday to Friday, so at 9 o'clock until 5. So it's not open today, but so 9 o'clock tomorrow morning if anybody wants to ring that.
Thank you. And a question to kick us off about the alphabetical system for supermarket attendants. Persons are asking whether that also refers to the sister islands and whether there's any categories of exemption, for example, seniors or vulnerable people or carers shopping for those people.
It applies right across the islands. The seniors and essential workers and the vulnerable can go anytime during the day, which matches their surname, the initial which starts their surname. But there is a special carve-out for them when nobody else will be there but seniors and essential workers, so that they can get in quickly, do what they need to do, and leave. But the A to K and L to Z or Z, what am I looking for now? The requirement that, or the limitation that you can only go on alternate days applies to everyone across the board, whether you're a senior, whether you're an essential worker, or whether you're just the average person. The A to Z, the alphabetical designation and requirement applies to everybody.
Thank you for clarifying, sir. Any questions from the media? Kevin?
Premier McLaughlin, just to clarify what you were just talking about, essential worker, that's government and private sector, correct?
If you are designated as an essential worker, yes, but you're going to have to have the ID.
Right.
In fact, everybody's going to have their ID.
So they should bring their relevant paperwork with them when they go to the supermarket. All right. Thank you.
Just a question that came in. How will this alphabetical ordering be policed? Will it be with the police or the supermarkets themselves will be doing the checking? How is it going to work out?
It's going to take a joint effort. But frankly, if you know that that tomorrow is A to K, and your name begins, and your name is Levy, you shouldn't turn up tomorrow at the supermarket.
Okay. Another question that came in relation to the students and residents that are at the isolation facility. Can you provide us with any updates on them? How many have been released from isolation? How many remain? Do you have any numbers that you can share with us?
No, I don't have the numbers, but I can say that I had a Zoom call with them yesterday, and we discussed a whole range of things and matters, how well they're doing. I think everyone is doing well. As far as I'm aware, no one's taken ill. They're obviously, a little stir crazy. Some of them have been there for a week now. But I want to again publicly commend them for their sense of responsibility. And it is one which I would hope that the rest of us who are not in isolation would have regard to in the way that we conduct ourselves over the course of this period when we're in curfew.
Thank you.
Just received a couple of questions about indigents or people who may not have government-issued ID. Have we any provisions for that or figured out a way to address that concern? In terms of the store and shopping.
Well, they'll have to convince whoever's there that they are who they say they are. If you don't have a driver's license or a voter's card or a passport, you'll have to take, I guess, your CUC bill or something, a photograph or something that says who you are. I don't know that we can make provision for people who don't have any form of ID. At least not on short notice.
Thank you.
Minister Seymour, just following up on some of the numbers with the personal protection equipment that you had talked about earlier. Some of the numbers that you said that we have on hand with certain items seem to be pretty far off from the numbers that we have on order. Would you say would you describe some of those pieces of equipment as saying that we're short on them? And just generally, is that something that you're concerned about?
I would agree with your assessment in terms of some of these things you'd look at and say they're short, especially when you look at face shields with and without masks. We have 360 on hand and 52,000 on order.
Right.
Well, the way I would look at that is the whole world has a problem, not just the Cayman Islands. So we probably ordered these for some time now, and they just hadn't come. So I'm not. I can't say I'm not concerned that we don't have them on hand, but I'm pleased with the efforts that the HSA and the Public Health Department is making in trying to get these here, along with the Governor and Premier and other efforts that they're trying to do through the FCO in the UK. So yes, a little short, but very hopeful.
Thank you. And I guess just naturally, Governor Roper, any update with the air bridge?
I don't think I can say any more today. That I want to make an announcement as soon as possible, and discussions are progressing really well. But I don't want to say any more today. Hopefully, we'll have more to say on that tomorrow.
Thank you.
There are some citizens from other countries who also are in Caymanian families as well, who may have similar emergencies to the ones that you've referred to. How do they go about things? Do they contact the same number, given previously, and you guys will try to facilitate for them?
Yes, it's open to anybody. I mean, it will go to London, but it can take anybody from London can go if they can get anywhere else. So we will listen to anyone who has concerns and try and help if possible. And I would also ask all the honorary consuls, who I'm sure are in touch with their own nationalities, to encourage people to get in touch with us if there's anything they want to talk about.
And just, we did get a message in from a young lady who said she thought you'd said that the students might be at Sunshine Suites, but they're at Comfort Inn.
I think it was, yes, thank you for correcting me.
I wanted to announce a bit of good news. The government is planning on launching a jingles competition to engage our local musicians during this time, many of whom are out of work. We need to inspire and engage the community, as well as spread public awareness. And the details and submission criteria and more information will be launched tomorrow. So at tomorrow's press conference, but any jingle that is used will be given a prize of $1,200. So look out for more information on that tomorrow. It's a bit of good news. Yeah.
Kevin.
Premier McLaughlin, we just got a message from somebody in the BRAC. In terms of, the barge comes once a week, so in terms of the people who can go on what day, the people that are able to come the first day, are they at a bit of an advantage, I guess, versus those who have to wait a day to visit the supermarket in terms of getting the certain items that they may want to get? Is there any way to address that?
No.
No? Okay. Thank you.
A question for the Governor. It may be too early to say at this time, but some positive indications from the UK that Public Health England might be about to roll out an at-home COVID-19 testing kit. And the question was whether that might be something that the overseas territories would receive.
Yes, I think in my comments I said that there is a lot going on behind the scenes on this at the moment. The testing is becoming increasingly important, and yes, the UK, there's some interesting and exciting things happening fast there, and I would absolutely want to ensure the overseas territories, and I'm sure they will be a part of that. So we'll be having discussions with Public Health England. I just want to add to what the Minister said as well, so that the testing kits that are coming from the UK, funded by the Foreign Office, does also contain a big consignment of personal protective equipment. So that's part of that delivery as well.
Great, thank you.
The only thing I would add to that is to say that because we aren't announcing certain things, it's not that we're not working on them. It is that we don't have concrete plans in place or concrete acceptance of what we're trying to do by certain places. But we are doing everything we can to get as much testing kit here as possible. Ideally, we'd want to be in a position where we can test every single person here, because quite frankly, that's the only way we know for certain where we are. But we've recently gotten in another 500 kits, right, Dr. Lee?
Yeah.
Just yesterday. But we're looking to source much more than that, because ideally what we want to do is to test everybody on the front line first. All the medical personnel, all the security folk, the police officers, people who work in the supermarkets, because they're the front line in this battle, and we want to make sure that they're okay. So we're doing everything we can very quietly behind the scenes to see what we can do, and we have quite a bit of hope that we will be able to beef up significantly our ability to test more broadly over the course of the next couple of weeks.
I think
If I could just perhaps provide a point of information on that issue to distinguish two different types of testing abilities. The ability that we currently are using is what's being used around the world is called polymerase chain reaction, or PCR, and that's what we have at the HSA, and which we're going to be bringing along at the Doctors Hospital. It's also the basis for a lot of the quick kits that you're seeing are being approved by the Food and Drugs Administration. They are different to the immunoglobulin tests, which are much easier to perform, and which undoubtedly will be coming alongside. Unfortunately, the two tests are not the same. So a PCR-based kit is going to tell you if you have an infection right here and now and that your viral load is high. The immunoglobulin tests that are currently available and are being tested are not so good at testing that you have it now, but what it is probably going to be good at telling you is if you've had the condition. The immunoglobulin tests will get more refined and better as time goes along. So it could become a time where they can tell you whether you've got an infection now as well as whether you've had a past infection. But the two together are going to give us a lot more information because it may enable us to say whether you've had an infection and and if you've had an infection in the past, then it's very likely that you're going to have a degree of immunity. So it could be that you're safe to go about. So.
One of the things I wanted to add also is in terms of in addition to what Premier said, this was something I was thinking about. I hadn't even discussed it with the team as yet. But for us to ensure that we rid ourselves of any possible spread on here and persons that can actually spread it in terms of testing, that we may have to go out to each district and do testing on persons that not even showing symptoms, that might just be asymptomatic. Maybe Dr. Lee can correct me if I said anything wrong there. But I think this is one of the ways that we may need to also go that route.
If we have no further questions from the media, any closing comments from the panel this afternoon?
Just to, again, urge everyone to stay at home as far as possible. And please, let's continue the way things are today in terms of the roads. Let's not treat tomorrow, Monday, as though it is a usual work day with everyone on the road, unless you are on an essential mission, one of those that is permitted under the regulations. Please stay at home. Have a blessed Sunday afternoon.
Thank you. And thank you very much for joining us this afternoon. A reminder, you can get the latest information on gov.ky/coronavirus. Remember to follow all the Cayman Islands government social media channels. We're on Instagram, Facebook and Twitter. And make sure on Facebook you've adjusted your notifications so you know when we're live and when we'll bring you the next press briefing. We'll see you again tomorrow. Thank you.